Normally on the Hair Transplant Road Show, I interview an expert from somewhere in the world on a topic of mutual interest. This will be a little different, as I'll be talking about something I use in my office called my walkaway rules. Over the years, I've identified 12 rules that can help patients avoid a bad outcome. A good part of my practice is devoted to repair work, and if patients had used these rules, most of them would never have needed any repairs. This will be part one of a two-part series. As a patient, you should take all the time you need before you undergo surgery. Research the procedure and the surgeon thoroughly. If you're unsure, you should wait. It's never too late. When you're comfortable that you found the right procedure and the right surgeon for you, then it's time to schedule surgery. This will be a two-part series, and now in part one, I'll discuss walkaway rules 1 through 6. The following are all important warning signs that a patient may be dissatisfied with the results of hair transplant surgery. Rule number 1, if a surgeon is not a member of the ISHRS, the International Society of Hair Restoration Surgery, and certified by the ABHRS, the American Board of Hair Restoration Surgery, walk away. The ISHRS is the world's largest educational body in hair transplantation, and any doctor anywhere in the world who is not a member is not committed to education. Within the ISHRS, we both learn and we teach, the two hallmarks of someone who is interested in advancing their personal skill set. So non-membership in the ISHRS is a huge warning sign. The American Board of Hair Restoration Surgery is a testing organization. So it's an examination organization. It doesn't guarantee competence again, but in order to become certified by the ABHRS, it's a long process of education. They test you both an oral and written examination on anatomy, physiology, pharmacology, all sorts of surgical techniques. To be able to pass that takes a huge effort. So it's a demonstration to commitment to education and to bettering oneself. So if your doctor is not a member of both the ISHRS and certified by the ABHRS, just walk away. Rule number 2, if you're pressured into signing a contract before you feel comfortable, walk away. Any high-pressure sales approach, whether you're buying a car or a house or undergoing surgery, high pressure is always bad. It means someone's a little desperate to push you into it. And the worst thing you could do is do something before you're ready. You'll be regretting that decision forever. So there's no deal that should only be available today or tomorrow. There's no opportunity that's going to be missed. Take your time. If you're much better off walking away than regretting a decision that you've made. Number 3, if you cannot meet with your surgeon on the day of your first visit, walk away. There's no other cosmetic procedure in all of medicine, blepharoplasty, facelift, nose job, breast augmentation, liposuction, where you don't get to meet your cosmetic surgeon long in advance of surgery, so that surgeon can spend time with you to discuss what your needs are, what your expectations are, and you have the opportunity to talk to your surgeon. Only in hair transplantation do people think it's okay for the patient not to meet the doctor before surgery. That's terrible. You have a right to talk to your doctor. In my office here, if I'm not in the office, we have people to answer the phones and cover some initial answer questions. But no consultation takes place right here in this room if I'm not physically here in the office. So if you can't meet your doctor on the day of your first visit, walk away. Number 4, if you suspect the doctor has inadequate training or experience, walk away. Now this could be tricky because doctors come across as confident and knowledgeable. So you have to ask the questions. Doctor, how long have you been doing this procedure? How many procedures have you performed? Now we all have to learn, but do you want to be the first 1 or 2 or 5 patients for your surgeon? Probably not. So asking these questions, examining carefully what the doctor's training and how long ago it was, will help you avoid an inexperienced doctor. Inexperience will result in problems. Walk away. Number 5, if the surgeon does not personally harvest every FUE graft, walk away. For follicular unit excision, that's a surgical procedure. Harvesting an FUE graft is a full thickness skin graft, which cannot, must not, should not be delegated to an unlicensed individual. Unfortunately, many offices that perform FUE do just that. The doctor doesn't do the procedure or the harvest him or herself, but delegates it to someone who's unlicensed. That's a recipe for disaster. We've covered this in a number of other episodes. In my office, when we do FUE, I personally harvest every single FUE graft myself. Never, ever delegate. You need to ask the question and ask it directly. Doctor, do you personally harvest every FUE graft? There's only one right answer, yes. If the doctor says, well, I supervise, well, I'm in the room, well, I'm available, well, it's not necessary to, all those mean no. Thank you. Walk away. Number 6, if you cannot meet with or speak to several recent patients, walk away. Now, many patients are very private and they don't want to be contacted, but all of us who've been operating for a period of time and do good work have patients that are so pleased, so great, so gratified at the results. They'll say, Doc, if you have a patient who has questions, who's not sure if they should sign up, have them call me. I'll tell them how virtually painless it was, how easy the procedure was, how pleasant everything was, how good the food was that you fed us for lunch. And they're happy to meet them for coffee. Now, not everybody wants to do that. So if your doctor can't come up with some patients that are willing to be spoken to, it either means they don't have any happy patients, which is a problem, or again, they're a beginner. They haven't been around long enough to have enough patients to make that offer. Either way, it's a warning sign. Walk away. So that's 1 through 6. In part 2, I'll discuss the remainder of these critical rules. So look for the next episode of the Hair Transplant Road Show.